Hi, I'm Dr. Leigh de Clifford. I'm the Technical Services Veterinarian for Contura Vet, and I've been working with Arthramid for roughly 12 years now. Today we're going to discuss top tips and also answer some frequently asked questions about how to use Arthramid. So when it comes to maintaining sterility, there's nothing special about doing this with Arthramid. I approach it exactly the same way as what I do with any other intra-articular injection. First of all, it's restraining the patient appropriately in good settings. So obviously doing that ideally on a concrete floor, or at least somewhere which is clean and not muddy or dusty, and also having the patient mostly sedated for these procedures. I very rarely do any joint injection unsedated. The other thing too is obviously using sterile gloves, scrubbing the joint appropriately with the technique that you developed at your clinic. And when it comes to post-injection wrapping of the joint, I personally wrap fetlocks, pastons, coffin joints, and I don't routinely wrap knees, hocks, and obviously stifles is quite difficult to do. Repeat dosing of the product can be done as required for several years. So we've got our independent data analysis on that fact, and we found that horses can have up to 7 injections over the span of 6 years. That was conducted in flat racing thoroughbreds right through to repeat injections throughout the horse's career over roughly 12 to 13 years. The repeat dosing in partial responders can take place at 4 to 6 weeks. If it's 6 weeks after the second injection that you find that the horse hasn't responded 100% to it, then further diagnostics are required to make sure that you've made an accurate assessment of the patient and that nothing else has developed in that time. One of the trickiest things in using Arthramid is the administration of the product into a joint that you do in the flex position. So the two most common joints that I personally do in the flex position is the fetlock and the knee joints. So I'll just show you a bit of a mock-up on how I do this. Obviously, I'm not sterile, we're not going to inject the horse, but this is my technique. So I pick the leg up, and obviously now this hand is now dirty, but then I use it just to find the joint, and I don't flex the joint too much because that makes it harder to inject through. So I have the needle in this hand and the syringe is just like this. Place the needle through, then wiggle this one down, which I've pre-cracked that to make it easier to put on. Take it off, attach it onto the needle hub, tighten it through, wiggle back, which as you can see isn't the easiest thing to do. Push the plunger in, work your way back up to the end of the needle, disconnect with that hand, drop that on the ground, move this around, crack it off, attach it to the needle, plunge it through, pull out all together. So one of the other joints that you do in the flex position are the intercarpal and radiocarpal joints. And so the way I approach that is that I have the needle attached to this syringe, unlike the fetlock, which I keep it separate. I then take this hand, whilst pushing on the horse's shoulder, using my wrist to flex the leg. I then pull my hand through, so that is now sterile as well. Find my landmarks, inject in, crack, remove that one, and pull this around, attach onto this needle, place the plunger in, pull out. And in that way, you've done the whole procedure whilst maintaining sterility. So one of the most common, I suppose, mistakes that can occur when using Arthramid is not getting it into the joint, and which can be tricky at times, which is why it's imperative to make sure the horse is appropriately restrained when you're doing the procedure. But also, as I've talked about previously, using a 21 gauge needle, because the product will not be able to be forced through that if you're not in a synovial cavity. Again, using ultrasonography, in particular for stifles, to get your landmarks, know exactly where you're injecting into, but also having a syringe of sterile saline that you can administer through that needle when you believe it's in the joint to ensure that it's present. So with all intra-articular products, the risk of both an iatrogenic sepsis and also a joint flare can occur with Arthramid. Now the risk of a infection within that joint is exceptionally low and lower than products such as corticosteroids, as it doesn't have an immune suppressive effect like corticosteroids, and so, but again, you manage them exactly the same way. There has been talk about the fact that the product can interfere with aseptic process management if it occurs, but this is incorrect, and you can manage that patient exactly the same as you would if any other product was used. When it comes to joint flares, this occurs through a different mechanism with what you see with other products, in particular corticosteroids, as the product induces an immune reaction, which is how you get the improvement in biomechanical effect on the synovium. And we do find that some patients have an overzealous response of their immune system to the product. I've only ever had 2 over the last 12 years, which required administration of products post-injection because of a flare. And I manage those with ice, compression, systemic use of non-steroidal anti-inflammatories. I've had one patient where I used an intravenous regional perfusion of dexamethasone to help reduce the immune response. And to date, both those horses have done exceptionally well. And through my role at Arthramid Vet, I've helped counsel several vets internationally on how to manage these flares, and today we have a very good success rate. My one key tip for anyone is that where possible, don't go in and do aggressive arthroscopic flushing, because that does aggravate the joint further. In addition to that, some intra-articular antimicrobials will have a very similar effect, which will create a much more severe situation than what you actually had in the beginning. I'm extremely happy with the safety of Arthramid. I've only had 2 flares over the last 12 years, both which resolved exceptionally well, and I've had outstanding results over again a long period of time to help support the use of the product. Furthermore, the product is produced under GMP certification, and furthermore it's used in human medicine routinely in a vast number of countries. The horses can receive multiple injections over their career. We've got several horses analysed by independent research that have had over 7 injections each across multiple joints, and we know that there's no adverse events that occur from giving repeat doses, and there's no increase in any risk once a particular joint has had multiple injections. Well, I hope that helps, and if you have any further questions on Arthramid, feel free to make contact on the website at arthramid.com.